position. Is she comfortable? Are you comfortable?
Mm-hmm.
Is patient position good?
She's comfortable.
She said so, but everything else is reasonable. It's reasonable. I wish I had high-low, but that's over there. So we're going to do it here. Now, my position, where do I stabilize? Stabilizing hand. Without even looking, you should, where am I going to stabilize?
Forearm.
The forearm proximally or distally? Why am I going to forearm proximally?
You
Why?
don't want to cross the elbow.
To stabilize, that's right, this is actually adding stabilized force because in this case, if I'm here and she starts resisting, what's going to happen here? She may wind up doing that, some cheating motions. So in this case, I'm going to get a little further down to hold that forearm in place just to stabilize here. Now, my resistance hand is now going to be down distally, right? So is there any particular way that I want to resist this? Do I do here? Do I do here? What do I do? Just whatever's comfortable is what I tell people, for the patient and for you. So I'm going to try and resist without crossing too far down, and I just want to try and get her to resist. Same thing goes, same words, same everything. I'm going to show you, you're going to raise your hand up as far as you can go comfortably like that. I'm going to add some resistance, you're going to match the resistance, and then we're going to go down, you're going to let it go down, but you're going to match my resistance on the down phase as well, so we can get both components, okay? So match my resistance up, that's it, match my resistance, there we go, nice and light, and then match my resistance down. Don't let me get too fast, gotta match it, okay, try again. Match my resistance, I'm watching my patient, that's okay, right? No pain. And match my resistance. There we go, that's better. Nice and smooth motion, okay? Then we can do isometrics, yes.
So should fingers be extended when doing an
Well,
extension?
there's a really good question. So now, what do we do and what do those extensor digital arm, what's it do? It extends the fingers. It depends, it really depends on what your end goal is. What muscle groups do you really want to focus on? Sometimes if there's a acute tendonitis going on there, I will tell them to relax the fingers, not extend them. If I want to go for the whole functional movement, I'm going to try and get some extension. Now, bear in mind what happens to the fingers as I go all the way up. What could happen?
Insufficiency.
Which kind of insufficiency?
Active.
Is it active? If they
Passive,
curl?
flexors.
That's passive insufficiency of the flexors at this point. So bear in mind, I may get that. Or if they're tight on the flexor surface, that's going to cause a restrictive barrier. So then I want to make sure they let them go because of the passive insufficiency on the flexor side, creating that. So again, that's a good clinical question that you've got to assess and decide what your main goal is. So there's a case where we have to worry about active and passive insufficiency, both. That's flexion extension. Flexion's the reverse. You just turn the hand over. You don't have to see that one. You can work on that. Work on those next, then we're going to start the leg.
Okay.
Okay.